Morning, how are you? Wish you are fine. If you want to have an inquiry about the protocol for
Hi, let's
hemifacial
talk about the
spas,
muscles of facial
here
expression.
it is.
In
Let
this
us speak
video, we'll
about
discuss the various groups
hemifacial
of facial
spasm.
muscles, how they're
Contrary
distributed
to
about the face,
Bell's
their
palsy,
functions, and their
hemifacial spasms
innervations.
are often caused by
So,
irritation or damage
the
to your
superficial
facial
muscles of the head
nerve.
are divided
They
into
are
two
commonly
groups.
caused by a
The
blood vessel
epicranial muscles are those
pressuring
muscles which are
on the
upon
facial nerve
the
near
cranium,
where the nerve
and the
connects to the
craniofacial
brainstem.
muscles are those muscles
When
of
this
the cranium
happens, the
but
facial nerve
associated
may
with
act
the
on its
face.
own, sending
The
out nerve
craniofacial
signals
muscles
that
can be
cause
grouped
facial
according to
muscle
the orifice
twitch.
that they control.
This is
So, for
known
instance,
as
surrounding
effective
the orbit
transmission,
and
it's
palpebral
one
fissures
of the
are the
main causes of
circumorbital
these
and palpebral
spasms.
muscles.
When applying
Surrounding the
pressure,
nares and nose are the
SG
nasal muscles.
17
And
on the
surrounding the
affected
oral
side,
fissure, so
patient will likely to
the
report soreness
labia
or
and the buccal or
worsening
cheek
of
regions are the
symptoms. In
buccolabial
mild cases,
muscles.
this condition
So let's take this
can
group
be
by group.
relieved by
So the epicranial
SG
muscles are
17
more
and
diverse
C1,
than what
C4
will be discussed here,
GJ
but the major
points with
epicranial
reducing
muscle
methods.
is the
Moxa or
occipitofrontalis
warm
muscle.
needling to
So
about
occipito,
points. Soft
occipital,
tissue massage
frontalis,
release
frontal.
to the
So those are the two
suboccipital
bones
region.
that these muscles are going to
Magnesium, which you can
attach
get
to.
from almonds
So
and bananas.
we can
Chamomile, which is
conceptualize the
available as a tea
occipitofrontalis muscle
or
as
tablets.
one large
Blueberries, which contain
muscle with two
muscle-relaxing
bellies, a
antioxidants.
frontal belly and an occipital belly,
And if you
with a large
want to
epicranial
concentrate
apenerosis
on
between the
nutrition,
two.
you will, see
Or we
that
can
vitamin
conceptualize
that
them as
is
two separate
very
muscles,
important,
the
especially
frontalis
during
and the
corona
occipitalis.
and
For the
magnesium,
purposes of this
chamomile.
video, we'll treat them as
Magnesium is
the
available
same muscle
in
with
almonds and bananas.
different
Chamomile,
innervations. So
you can
when
take it
active,
as tablets
the
or as
occipitofrontalis
tea.
muscle
Blueberries,
is going to elevate
contain
the brow.
muscle-relaxing
So it gives this
antioxidants. So in general,
look of
if
surprise,
you want to know
perhaps
more,
slight
which one of
condescension,
them
depending
is
on how you want to
more
mix and match
suitable
this.
for you, more
So
than
the
others,
the
follow
greatest
the
amount of movement
videos
and
which
expression
I
here
made
is
about
generated by that
blood
frontal
type
belly.
and
That frontal
suitable
belly
food, which
is
related to
innervated
blood
by
type.
temporal branches of
If all
the
of the
facial nerve.
above doesn't help,
And posterior to that
patient
frontal belly, we have a
to
very
other
large
treatments
and robust
Botox
epicranial
or surgery.
apenerosis,
Because
which
of
we
that,
can also see
I have
here as
a
well.
lot of
This can be
courses
very,
about
very extensive.
hemifacial palsy,
The occipital belly
which I
is
use
usually
Botox
smaller than
to
the
treat
frontal
them.
belly, and we
you
can
will
see that
feel
here.
there is difference
And
between,
typically on cadaveric specimens, it might be
difference
very
of
hard to see. It tends to
best
atrophy
result
and
between
go through a process of
80
fibrosis with
to
age. So if
90
you don't
and
see a
maybe
very
more.
well-developed
If you like this
occipital
video,
belly
please
of
make like,
occipitofrontalis,
share,
it's not the end of the
subscribe
world.
to
It's
my
probably quite typical.
YouTube channel.
The interesting thing is that
Good
that
morning,
occipital
how are you?
belly
Wish you are
is
fine. I'm Dr.
innervated
Bassem. I'm plastic
by
surgeon.
a
I want to
different
speak about
set of
Bell's
branches versus the
Bell's
frontal
palsy.
belly. So that occipital
What
belly
is
is innervated
Bell's
by an
palsy?
occipital branch of
It's a
the
form of facial
posterior
paralysis
auricular
due
nerve
due
of
to
the facial nerve.
dysfunction
So
of the
that's
cranial
that
nerve,
nerve that comes out of the
the
stylomastoid
seventh, the
foramen,
facial nerve, causing
heading
an
back that way. So
inability
it's going to
control
innervate
facial
the
muscles
occipital
on the
belly.
affected
It's also
side.
going to
Often,
innervate
the eye in
the
the affected
posterior
side can
auricular
be
and
closed.
sometimes even the
What
superior
are the
auricular
causes?
nerve. But
Infection,
oftentimes
trauma,
that is
surgery,
dual
any
innervation
pressure
between
on the nerve
the
due to any
occipital
reason.
branch and those
The
temporal
common
branches.
presentation of this condition is a rapid
Moving on
onset
to
of
the
partial or
craniofacial group,
complete paralysis
let's
that
start
often
superiorly
occurs
and
over
work
time.
our way
In rare
down.
cases,
Orbicularis
less than,
oculi.
1%. It can occur on
So
both sides,
orbicularis
resulting
oculi, let's
in
break
total
that
facial
down.
paralysis,
Muscles can be named
rare.
a variety of
Less
ways.
than
Sometimes
1%.
they're named for
Treatment.
their attachments
Paradigm
or the regions that they
stimulation,
overlie.
specific points.
Sometimes they're
Infrared,
named for the direction of
galvanic,
their
facial
muscle
massage,
fibers or their
and
fascicles.
exercises.
And in this case,
Massage,
it's a
half
little bit
circle.
of that and
The
a little bit
therapist
of
stands behind
regional. So
the patient and
orbicularis means
one
that the
hand
muscle
on each
fibers
side
are
of the face.
arranged
The
in a
therapist's
circular
hand on the
fashion,
affected side is pulling
like so.
upward.
And
And the
oculi
other hand
refers to
is
the eye.
pushing
So this
downward
is the
as
muscle
if he is
with circularly
correct the
arranged
mouse
fibers that
position.
overlies the eye.
Circular
And there are
massage.
three
The
parts to it.
therapist's hand on the
There's
affected
the
side
orbital
is
part.
at the patient's forehead, and
The
the
orbital
other
part
hand
is the
on the
largest
patient's
part
side
of
of the
orbicularis
mouth.
oculi. That would be
The motion
everything
starts
between these
same
two
as the half
circles
circular,
that I've drawn.
but the two hands move
That orbital
along the
part
face,
is
making
what
a complete
voluntarily
circle,
and
complete
forcibly
circle,
closes
until the
the
hands
palpebral
are
fissure.
in opposite
The
positions.
palpebral part, that would
Then
be
the
everything
therapist
within
slide the
that
hands gently on the
almond-shaped
face to the starting position. Segmental
area
massage.
that I've
The therapist
prescribed
uses the middle and index
overlies
finger
the
on
palpebrae,
on
so that
the
was very
affected
well
side,
named. And the
massaging
palpebral part
every
is
segment of the face from
voluntarily
inside
controllable,
out.
but
The
typically
fingers
is
should be
under
separated,
involuntary
massaging the
control.
chin,
So
the mouth, the eyes, and
blinking
eyebrows.
is a function of the
Forehead
palpebral part.
massage,
You don't
using
spend
the
most of
middle
your
and
day
index
thinking,
finger of
time to
each
lubricate the eyes,
hand
so
moving up and down.
we have that going for us. There's
Opposite to
also
each
a
other
third
on
part
the
of this
forehead
muscle,
with
which lies
two
deep
fingers
here in the
joined,
medial area,
also moving
by
in
the
and
medial
out,
angle
with
of the
fingers
eye, called the lacrimal part.
separated.
And this is overlying the
Exercises
lacrimal
start
apparatus
with
so as
activation of
to
platysma.
squeeze it to create
Cheeks
pressure to
raising
draw tears
exercises
across
to
the eye.
maintain nasolabial
Now,
growth and enhance
all parts of
eyebrows.
this muscle are
Downward
innervated by both
movement to
temporal and
facilitate
zygomatic branches
eye
of the facial
closure.
nerve.
Deep
So one of the
contour
landmarks that I use
exercises,
is
deep
that
training
lateral canthus.
exercises, blinking
So
training.
we'll have temporal branches above
According
and
to the time
zygomatic
of
branches
recovery
below.
depends on the percentage of nerve compression.
Now,
It
deep
takes 6 weeks
to
in the cases of
orbicularis
minimum compression,
oculi,
but
and
it
also
takes
deep to
longer
the
in
frontal
most
belly
of
of
severe
occipitofrontalis,
cases.
is a
Instructions
small
and home program.
strip of muscle
Do
called the
these exercises
corrugator
with
supercilii.
50 repetitions.
Corrugator
Hold 3
supercilii.
seconds for each exercise you do.
So this is
The
the
more you
superciliary
exercise, the
region,
better
and
outcome.
corrugator,
And
to make
fine.
corrugated, this is a
I'm
furrower
speaking in general
of
about
the brow.
the
So when this
hemifacial
muscle
palsy
contracts,
and bells,
like so,
because I use in general
pulls
I
the
use
brow
Botox,
together.
To relax the muscles. And as I
This
told you,
is
that,
an action
the
that
patients
people will
get,
take
good
involuntarily
result. It is
when
as
they
percentage between
are confronted
80
with a
to
bright
90.
light. So this can be paired
like the
with
video, please
squinting.
make
So
like, share,
along with
subscribe
orbicularis
to my
oculi, you
YouTube
can
channel.
contract the
Good
corrugator
morning, how are
supercilii
you?
so as to provide your eyes a little bit more shade. This is also something that sometimes involuntarily gets paired with a disdainful feeling that you might have for an individual. Considering this photograph was taken indoors, obviously this person is acting, but this kind of looks like perhaps the recipient of the gaze is in a little bit of trouble. Corrugator supercilii is innervated by temporal branches of the facial nerve, so everything above there would head that way.
To muscles for facial expressions. Other fibers.
Next up, the buccolabial muscles. So we're going to skip over the nasal muscles ever so briefly to turn our attention to those muscles that are associated with the oral fissure. So there are several here, and one of them is going to be in that nasal group, and we'll come back to this one. This is one of my favorite muscles.
The zygomatic
Levator labii superioris aliquinosi. But
nerve.
let's begin with this muscle
The
here.
zygomatic nerve,
Levator
the
labii
buccal nerve,
superioris.
and the mandibular
Levator
nerve.
labii superioris is just inferior to
In
orbicularis
general,
oculi,
trying to
and
put
it's
our
going
discussion
to
about
the
some,
the
of
superior
anatomy
lip
which
or
are
the upper lip.
important when we want
And
to
when
make
levator
Botox
labii
or
superioris
videos.
muscles
That's all
in
about this
tandem, so
video
let's
and
say we
session
had
ahead.
both of
If you
these
like this
firing
video,
at the same time,
make like,
that is
share,
going to
subscribe
elevate
to my YouTube channel.
the upper lip,
Morning, how are you?
hence
You
the
are
name.
fine. Dr. Bassem,
We also have moving
Center.
lateral
Speak about
zygomaticus
Botox and
minor.
muscles
Zygomaticus
of facial
minor is over the
expression.
zygomatic bone.
Facial
And there are
expression
two of
is
these,
one
and so the smaller
or
of the
more
two
motions
gets
or
the name
positions of the
minor.
muscles beneath the skin of the
Zygomaticus minor, when it fires, is going to pull the lip
face.
superiorly
to
and
speak about
laterally. So we have kind of an oblique vector there, and it is going to uncover the teeth to about the canine. So there is, let's see, central incisor, lateral incisor, canine. It just barely bears the canine.
The skeletal muscles of the face are different.
Sometimes the zygomaticus minor is present, sometimes it's absent, sometimes it can be indistinguishable from zygomaticus major, so those two muscles can go together. Nevertheless, you know, if it's there, wonderful. If it's not, it's not the end of the world. Moving laterally, we have the zygomaticus major. Zygomaticus major is overlying the zygoma, or the zygomatic bone, and is larger than the minor. We can see here that both of these muscles are coming down to participate in the modiolus. That's that interdigitation of fibromuscular tissues that is controlling the angle of the mouth. So what we have are a series of muscles that are going to contribute to an ever-widening smile. So levator labii superioris elevates the lip. Zygomaticus minor is going to expose to the canine. Zygomaticus major is going to go beyond the canine, as we can see there. So when used in sequence, we have an ever-widening smile. So how wonderful there. All compliments of what these muscles do to the upper lip and that modiolus. Control the modiolus,
over time,
and you control the mouth.
Facial expressions, fine lines,
these three muscles are all innervated by both zygomatic and buccal branches of the facial nerve. So zygomatic and buccal branches of the facial nerve. Deep to these muscles, along with levator labii superioris aliquinazi, is that infraorbital or canine fascial space.
Into specific muscles on the face. This is why a skilled injector with advanced understanding of
anatomy and oral fissure facial expression is going to be orbicularis oris. This is the money muscle in terms of social media photography. So orbicularis, those circularly shaped fibers, oris of the oral fissure,
the effects of Botox
would be this muscle here. So this will be deep to and surrounding, deep to the skin of and surrounding the superior and inferior lips. And when contracted, this purses the lips. So if you think about that full-lipped ducky face that people make when they take selfies, that's compliments of orbicularis oris. And orbicularis oris is innervated by buccal branches. So we've got buccal branches coming across, and marginal mandibular branch of the facial nerve. Next up, the buccinator muscle. The buccinator muscle is the deepest of all of the facial muscles here. So it's originating or attaching to that pterygomandibular raphe, and it comes and it is going to attach to the alveolar surfaces or ridges surrounding both the maxillary and mandibular teeth. So this is really forming the muscular wall of the cheek. When contracted, the buccinator muscle is going to push anything in the oral vestibule deep. So that's going to bring food into the occlusal surfaces or between the occlusal surfaces of maxillary and mandibular teeth for eating, which is a nice thing to do, right? It's helping the muscles of mastication by bringing the items to be masticated between the teeth. The buccinator muscle is interesting in that it is pierced
not
by
simply
the
acquired,
parotiduct,
but
and superficial
are
to it we have
innate.
a very robust and
In
nice
general,
buccal
let us
fat pad. So we can see that
continue
buccal fat pad here.
about
In the
speaking
cadaveric
about
image, we
the
can see
muscles, the
the
anatomy, muscles,
parotiduct
nerves,
moving
and
across and then
all
diving deep
about
into what would be
muscles
the
of
buccal
facial
fascial space.
expressions. So muscles
So
of
that
the
buccal
human
fascial
face
space
and
is
neck,
traversed
highly
by
important
Stenson's
for
duct, or the parotiduct.
non-verbal
Coming through this space
communication,
is the
which
buccal
helps
branch of
show emotion.
V3.
Humans
So the
have
maxillary division of the
well-developed
the
muscles in the
mandibular
face
division of the
that
trigeminal nerve
permit a large
sends
variety
the
of
buccal
facial
nerve
expressions
anteriorly
because the
through this
muscles are
space
used
to
show
afferently
surprise,
serve the
disgust,
skin of
anger,
the
fear,
cheek and also
other
some of the
emotions.
gingiva
They are
surrounding
an
the
important
molars.
means of non-verbal
Very frequently,
communication.
this
Muscles
buccal
of
nerve is
facial
referred to as the
expression
long
includes
buccal nerve
frontalis,
by clinicians.
orbicularis, oris, laris,
Now we also have
ocular,
a
zygomatic.
couple of other muscles controlling
That's all.
the oral fissure.
Let us
Life can't be
continue
all
in another
smiles,
video.
and so well, in this case, we're not done
Fine.
smiling.
And
Deep
I will pause
to the levator
a
labii
picture
superioris
which
is
shows
the.
the French
So here we have that levator labii
physiologist
superioris
Glumet
is the levator
Benjamin
anguli oris. So
doing
here,
one
coming
of
from the
his experiments
modiolus
on living
up
objects.
to the maxilla,
He
deep to
studied
levator
very special
labii
muscles
superioris
using
is levator
electric current
anguli
through
oris. It's an
electrodes on the
elevator
face.
of the angle of the mouth,
We couldn't
so
find
it's
the name of the photograph.
enabling a smile.
So
This
muscles
muscle
of
is
facial
innervated by
expression
buccal branches
supplied by
of
the facial
the
nerve
nerve,
are attached
as
to
it should
and
be for
move
that
the
region.
skin of the face,
We also have a
producing
highly
facial
variable
expressions.
muscle,
Daily
the
movements
risorius
like
muscle.
Smiling, frowning,
Risorius
and
muscle
chewing
may be
your
present, it
facial
may not be
muscles
present.
are
It goes from the
measurable
modiolus out
and just
laterally,
like your body
superficial
benefits
to that
from a
buccal
good
fascial
rub-down
space,
after a hard
and when
sweat
it's
session,
activated,
your face
it
benefits
pulls
greatly
the
from a
sides of,
massage
or the angles
as
of the
well.
mouth laterally,
So
as to
muscles of
produce
facial
a
expression
smirk.
form
And
grooves
like
around
levator
the
anguli oris,
orifices
risorius
and act
is also
as
innervated
filters
by
and dilators.
buccal branches
The purpose of the facial
facial nerve.
muscles is to control these orifices.
Now, some of the
various
frowny
expressions
muscles.
So
Let's start
on the
with
face
depressor anguli oris. Depressor
side
anguli
effects.
oris is originating from
in general,
that,
I make
or
some
I should say,
videos
attaching
to
to
show
the
the
modiolus
muscles
and going
of
down to
facial
the
expression.
mandible there.
So the muscles
Depressor
of the face are
depresses
fascinating
the angle
to
of
look
the
at.
mouth, so
They are
it pulls
different than
the angle of the
skeletal
mouth
muscles, which attach to bone.
inferolaterally.
Facial muscles
And this
attach
muscle
to
is
other
innervated
muscles
by
or to the
both
skin.
buccal branches
This
of the facial
allows,
nerve as well as the
for
marginal
a broad
mandibular
range of
branch
expressions
of
in
the
the
facial nerve.
face. Face massage
We also
is
have
so
depressor
important for
labii
helping the
inferioris
overall
muscle.
skin
Depressor
health.
labii inferioris muscle
Estheticians
tends to
are
be deep
trained
to
release muscle
depressor
tension to
anguli
smooth
oris.
the blood through
And this
the
muscle, when
oxygenase,
working in
clearing
concert with
away
its counterpart,
stagnation
is
and
going to
enveloping
depress
the
the lower
cells.
lip. So to pull it downwards.
Proper massage can also
We also
produce,
have the mentalis muscle. The mentalis
less
muscle is in the
movement
mental
of
or the
wrinkles
chin region.
and can
And
also
when
reduce
active, the mentalis
depth
muscle
and
is
sculpt the
going
face
to
for
produce a
smoother,
pout
longer
by both
look.
elevating and protruding the skin of the chin. So by pulling this chin skin upwards, it displaces the lower lip.
Did you know
produce the
that you
pout.
can exercise
And
your
mentalis
facial muscles
is
just like you
innervated
can
much
exercise
the
the
same way
muscles in
depressor
your
labii
body?
inferioris
Not
is
only
by
does,
the marginal mandibular branch of
microcurrent
facial.
work down in the
Now,
cellular
the
level
the
of
nasal
the skin to
muscles,
stimulate
starting with
new collagen
one of my favorite
elastin.
facial
It
muscles,
actually
the
goes
levator
deeper
labii
and
superioris
stimulate the
aliqui
muscles.
nasi.
It uses
So let me
a controlled
trace this muscle
low-level
for you.
electric
This is going to
current
blow
to
your
help
mind.
tighten and
So
tone
levator
facial muscles.
labii
The
superioris,
skeletal muscles of the
it's going
face
to
are different
elevate
from the skeletal
the
muscles
superior
that make up
lip
rest of your body.
which it does.
In your face,
And there's
many
also
of the
this
muscles
little
attach
slip
directly
of
to the
muscle
skin
that goes
or
to the
other
ala,
skeletal muscles,
or the wing
not to the
of the
endos or
nose. That's
bones.
the area above
This
the
means
nostril.
that a tiny
So
contraction in one of the facial
elevates
muscles
the
will
upper
pull
lip
the skin of your face
and
therefore
also the
changes
wing of
your
the nose.
expression. Because
So
of this
levator
unique
labii
feature,
superioris
we are
aliquinosi is
able to
going
make
to
countless different
dilate
expressions.
the nostril
This
and
is also
elevate the
why
upper lip. So I kind of think of this as
can
kind of like
produce
the
results
Elvis
after
snarl,
just
if you're
one
familiar with
treatment by
the
tackling
King of Pop.
certain muscles.
And this muscle
We leave
is
the
the
skin.
longest named muscle of any human muscle. So if you're ever at a trivia night and you're asked what the longest name of any muscle is in the human body, it's levator labii superioris aliquinosi, which is innervated by both the zygomatic and buccal branches of the facial nerve. Next up, we have the nasalis muscle. The nasalis, or just the nasal muscle, has two parts to it. Sometimes these parts are given their own muscle name. So we have one part, the transverse part, that is over the body of the nose here. So running along the bridge of the nose, down laterally. Now, when that contracts, it actually constricts the nares, and so that transverse part, when given its own name, is called the compressor nares. There's also another part from the alar region that when it contracts, it pulls the alar region outwards. That's the alar part, also known as dilator nares. So compressor nares and dilator nares are antagonistic to one another, and both are innervated by zygomatic and buccal branches of 7, which makes sense. And this leads us to our assessment question, and that would be, which muscle may both elevate the upper lip and dilate the nares? So elevate the upper lip and dilate the nares. Let's see. Levator anguli oris, that's going to pull the modiolus
like, share, subscribe,
superior laterally, so that's a smiley muscle.